My name is Lance French. I'm a student nurse, and I'm here to perform the return demonstration of an insulin injection. So firstly, I'm going to gather the materials, which will be a pair of clean gloves, at least three ethanol pads, an insulin syringe, and a vial of the specified insulin from the medication order and that agrees with the MAR as well. So firstly, we're going to check with the 6 rights of medication, which is the correct dose. I see I'm ordered to give 2 units of insulin. The right route is subcutaneously. The right medication, which I've checked, is the green medication of insulin. And we'll do the correct documentation and check that we have the correct patient and the correct time. So I go and I check the physician order, and the MAR is for 2 units of insulin, and I'm going to look at the vials for their expiration date, any defects, and the date and time when this was first opened, which is this one is new, so I'm going to be the person that initial time and dates when it was opened. So I'm going to rotate this just to make sure I don't see any precipitate, any cloudiness in here. It's nothing abnormal. So now I can open this and clean the top of the vial with alcohol. So I'm going to check a U100 type insulin syringe, which I have here. I'll remove this carefully, unhooking the cap and placing the cap on a clean surface. So I'm going to inspect for where the bevel is. I'm going to draw up my 2 units of insulin as is specified, and I'm going to pierce the cap, and I'm going to exchange air for the amount of medication that is ordered. So tapping that just to make sure I don't have any air in the syringe. And that looks great. So now I'm going to recap that right now, the scoop cap method. And I'm going to now knock on the patient's door, introduce myself, and have a second nurse check this insulin dose in the MAR before I do anything with this patient. And now that I've checked that and she has verified that for me, I'm going to identify the patient by 2 methods of identification, birth date and full name, and I'm going to explain the procedure and the medication to them. So we are going to select the appropriate site, which is on the abdomen here, and I'm going to explain to you that I would want the patient in a supine position with their abdomen exposed. And now we're going to clean the injection site. So here's the patient's injection site. I'm going to clean from the center out. And now I'm going to uncap that, seeing that my dose is still correct. So now, with my non-dominant hand, I'm going to pinch up a skin fold at that administration site. And since this person has a little bit of extra fluff, as we say, I'm going to use the 90-degree angle, go straight in, and then with my non-dominant hand, I'm going to brace the needle, and I'm going to inject the 2 units of medication. And now I'm going to in one motion recap this, not recap, but in one motion I'm going to put this needle into the syringe sharps container. I'm going to take my 2x2 gauze pad and I'm going to gently blot, not massaging and not rubbing this, just making sure. So the syringe and the needle are in the sharp container. Now I'm going to document what I've administered into the MAR, and which site, which side, and what dose. So thank you.